Hi, my name is Marc Weisman. Some of you know me, some of you may not. I am the founding and current medical director for the Beaumont Physician Organization. I'm board certified in family medicine and geriatrics. I practice primarily out of the Troy Hospital, but I'm on staff at both Troy and Royal Oak Beaumont. This is my first video, so I hope you'll bear with me. I'm trying to create a novel approach to providing some information to you. This will only be about 5 minutes long, and the purpose of it is to review for you the types of reporting that we have been working so hard on so that you can better understand how to go through the reports that we're providing you. The one in particular that we'll be discussing today is the PCP Fund Summary Report. The reports that you receive are basically data that we have received from the various health plans. The one we're going to be reviewing is the Blue Care Network report, but this pretty much holds true to all of the reports. These reports are based upon claims made. These are essentially your billing information received and paid by the health plans. So inherently, this data is not necessarily completely correct. We know that there are faults and errors within that data, but it's the best that we have. We at BPO receive these reports digitally, and then, or actually this data digitally, and then we recreate reports based upon the various attributes and rules that we have provided our IT team. I have been working over these last 6 months pretty diligently to try to improve the quality and the nature of these reports, because I believe that the greater your confidence that this information is vetted, accurate, and that we're using it appropriately and fairly, the more likely you are to be cooperative and helpful and not necessarily defensive and or critical of the information we are providing. The goal, of course, is that we hope that we'll be able to work closely with you. You'll work by yourselves. You can hopefully work within your own groups. We hope to improve the communication between primary care and non-primary care, and even between BPO and all of the doctors, using this information to try to find the most cost-effective and appropriate methods to deliver the highest quality of care possible. Okay, so let's go through this Beaumont Physician Organization Blue Care Network PCP Fund Summary Report. It looks something like this. In the future, I will actually import this document for you so it'll be a little bit easier for you to see it. I apologize. But if you'll take a minute to go find this report, it would be a lot easier, I think, if you actually had this in front of you. What we're going to do is we're going to go over the data for me, for Marc Weisman. The reason I'm going to do that, a couple of reasons. Number one, let's be fair about this. I happen to be an outlier. I am an outlier because the vast majority of my expenses were due to 4 cancer patients, but that's also going to be insightful and helpful as we go through this. You'll find my data on the 4th of 16 pages toward the bottom. Basically, each of our reports is accompanied by a key. The key looks something like this, which essentially defines the various terms that may be somewhat foreign to you. This is mostly self-explanatory, but you're not used to looking at these reports. I remember how confused I was when I first started reviewing these. So basically, if you look at the categories, you'll see the first category there is member months. That is simply the number of members assigned to the primary care physician during that allocated period of time. Covered lives, number of patients. The total claims paid is the total amount of money paid out by Blue Care Network for your apportioned patients. The allowance PMPM is an age, gender, and I believe also severity of illness, although I don't trust the severity of illness all that much, adjusted amount of money that Blue Care Network believes they should have paid during that period of time. To the right of that are 7 parameters. They include the PCP billable PMPM. By the way, PMPM is per member per month. That first category is the money that was actually paid to the primary care practice. The next is the specialist PMPM, the amount of money paid to the specialist office. The next is the ancillary PMPM, which includes various ancillary services outside of the office. That is followed by the institutional inpatient PMPM, which is basically what was paid to the hospital for inpatients. To the right of that is the outpatient PMPM. That is funds that were paid to the hospital for outpatient um, care that includes high-tech radiology, emergency room services, etc. To the right of that is the last category, which is the RX PMPM. This does not include GDR, which is the generic dispensing rate, or GUR, generic utilization rate, but rather the amount of money that was paid per member per month. Okay, next and last, we're going to go through this report a little bit so that I can try to describe to you what is unique about them. I've spent a lot of time with the IT people and the statisticians at the Medical Advantage Group, MAG, that is the outsourced company that does most of our management. Most reporting begins and ends with the PCP information via the category in terms of the funding allowance and whether you are above or beyond that. And you are defined as an outlier or you are not, and that's the end of it. We've done several things. You'll notice that these reports are broken down by the individual doctor, but also by the group. I believe that many patients, although assigned to a particular primary care doctor, are actually seen by any doctor in that group, and perhaps any PA or NP as well. So we wanted to break this down both into the individual doctors, but also as a group in its entirety. For instance, if a couple of doctors were outliers, but the others were much under what their expenses were allocated to be, the group itself, as a whole, is well within its range, and we're not even going to look at those individual doctors for the reasons that are obvious. There really isn't a problem within that group. So I think it's helpful to look at individual doctors, but also helpful to look at the entire group. You'll also notice that funding allowance, we have a lot more information here that I think will be very helpful for the individuals and for BPO to focus on the areas where that particular doctor or group seem to be struggling in terms of costs. Does not mean that costs are inappropriate or are unjustified. It just means that there is a clear overage, and we're trying to identify, of course, where behaviors or patterns can be amended to reduce unnecessary expenses when possible. So you'll notice here that for under my name, if you look at the PCP billable report, you'll notice that basically I'm within 2% of what the allocation was. So whatever money has been paid is not going to my office. The specialist report, on the other hand, and you'll see this is actually in pink on your report because that is my worst area, is minus 52%. So I've spent 52% more than the allocated amount to my specialist fund. Now, it turns out in my case, 48% of that was to medical oncologists due to the 4 cancer patients that I had. But nonetheless, it's helpful to be able to identify that so we can not spend our time identify or studying areas where there really isn't a problem. So in that PCP, or excuse me, that specialist PMPM category, you'll see that the allocation was $60.10. I've actually spent $102.50, and the overage is 52%. And that logic flows throughout each of these categories. If you look at my entire group, which is just one box down, you'll see that my group also has as most of its overage in the specialist fund. That's minus 44%, you'll see there. Again, the goal of this is so that as individuals we can look at these reports, better understand where that money has been spent. I hope that it will create individual evaluation and self-assessment. I hope that it will create dialogue within the primary care practice itself. It would be wise to sit down with all of your doctors and try to look at these patterns and understand and see if you can come up with some thoughts or ideas in areas that perhaps might be ripe for amendment or change. One of the reports that you're going to very, very soon see is a report that is going to show you as the primary care doctor, especially for outliers, it's going to show where the funds have flowed to non-primary care doctors or specialists, especially when those specialists are themselves outliers. So you'll see on one sheet of paper, you and the non-primary care doctor, although it is allocated back to you, you may be penalized economically, they are not. And I want both the non-primary care doctor and the primary care doctor to see the same information, hoping again to improve dialogue. If you as a primary care doctor are comfortable having conversations with the various specialists that might be on the expensive side, again, that may or may not be justified, that's great. If you prefer BPO or me personally to have that conversation, I'm happy to do that. But the most important thing is that we can begin to distill this information so we can understand the data, look at it, and hopefully utilize it to the benefit, to the mutual benefit of the physicians, patients, of course, and even the plan. I think I'll end there. I thank you very much for your time. I apologize for going over a little. I assumed that this would be closer to 5 minutes. I think it was more like 10 or 11 minutes. In the future, I will try to hone this information to keep it as distilled and relevant as possible. I will also learn to embed the reports or documents, which I think will make it a little bit easier to follow along. And I hope you have a great spring and summer season. I'm sure that the weather is eventually going to turn here. It's been a pleasure to serve as medical director, and I hope that you will be comfortable contacting me for any questions or information. If you want me to go over any of this, I'm happy to do so. The best way to reach me is at mweisman, Weisman, at beaumontpo.com. Thank you.